Is it ADHD? Is it autism? Or could it be both? The truth is, many people are misdiagnosed, or worse, not diagnosed at all, because we don't talk enough about the overlap between ADHD and ASD. These are two distinct neurodevelopmental conditions, but they often coexist, and when they do, it can complicate everything from diagnosis to daily life. ADHD, or Attention-Deficit Hyperactivity Disorder, is usually marked by inattention, impulsivity, and hyperactivity. Autism Spectrum Disorder, or ASD, is characterized by differences in social communication, sensory sensitivity, and repetitive or restrictive behaviors. But here's where things get interesting. A lot of traits overlap. Both ADHD and ASD can involve executive dysfunction, difficulty with transitions, trouble focusing, and even sensory overload. But the reasons behind those behaviors can be very different. A child with ADHD might interrupt because they're impulsive. A child with ASD might do the same because they're anxious about not getting a turn. One seeks stimulation, the other avoids it, but the behavior looks the same on the surface. That's why so many girls and women especially go undiagnosed, or are misdiagnosed with anxiety or depression instead. The research shows that up to 50% of people with ASD also meet criteria for ADHD. That's not a small overlap, it's huge. But most clinical systems still treat them like separate lanes. In reality, someone might need tools from both toolboxes. Emotional regulation techniques for ADHD, social scripting for ASD, sensory support for both. Understanding the overlap helps people feel seen. It explains why traditional approaches might not have worked. It opens up space for better support, at home, at work, at school. If this sounds like you or someone you love, you're not alone. The intersection of ADHD and autism is a very real space where a lot of us live, even if we've only just found the name for it.